Launch of the BRC and the CRF are incredibly important events. These are things we've been seeking for quite some time, and it's wonderful now to be celebrating success jointly with our hospital partners. Biomedical research in Manchester is extremely strong, and I think the BRC and the CRF mean it's set to grow. And of course this is an incredibly important time because of devolution of the health budget, so there are lots of exciting opportunities for Manchester for the future in biomedical research.
So the Biomedical Research Centre is a large infrastructure grant funded by the National Institute for Health Research, focused on early proof of concept experimental medicine studies across a range of clinical areas identified as areas of expertise within Manchester and of high unmet need to the health service. The BRC, embedded within Greater Manchester, has a strong focus in working with industry partners, be that big pharma or small, medium enterprises. In particular, to work with us on our aim of developing new treatments and better ways to personalise therapy for patients, for population benefit and wider economic gain.
The clinical research facility is a specialist dedicated research space which is provided for investigators to perform their experimental medicine studies on any of our sites throughout Greater Manchester.
By having the specific funding in the BRC and the CRF, it allows the integration of the scientists to bring the different scientific disciplines together, and when we create that interdisciplinary working, we can focus and make a real impact on disease areas.
So actually this was a competition based on excellence as judged by an international panel. So Manchester won the funding for the Biomedical Research Centre and the Clinical Research Facility on the basis of the excellent research that's supported here.
The health ecosystem in Greater Manchester is critically important because it brings together the work of academics with the innovative power of industry, and it aligns those to the health needs of our population. And so bringing that together into a virtuous circle will allow us to accelerate the process of innovation.
Manchester has some of the worst health outcomes anywhere in the country. Doing more of the same isn't going to work, so having a research facility of this sort in the city allows us to get improved clinical outcomes for people in Manchester, but also at the same time to have a whole research chain that creates economic value and jobs, that starts dealing with the social aspects of why people have bad health in the first place.
Using our BRC and CRF platform, we can start to identify what the best practice is on any individual pathway. So rapidly we can deliver those pathways across the whole of the conurbation. So we can up the standards of the care we provide to individual patients and to our local communities. So people in Greater Manchester simply get the best care far more rapidly than would otherwise be the case.